Health information for the Tri-Cities and surrounding region. Catholic Regional Medical Center presents Community Health Journal. And now the host of Community Health Journal, Jim Hall.
Hello and welcome to Community Health Journal. Today our program takes on a bit of a different look as we try to get you the very latest information amid all these social distancing restrictions that we're living under. Today we're devoting our entire program to the very latest information on COVID-19. It comes from segments of our weekly radio program called Catholic on Call, which airs each Wednesday from 6 to 7 p.m. on 610 KONA AM radio. The latest program was aired live on March 25th, 2020.
It's time for Cadillac on Call on News Radio 610 KONA. It's your chance to learn valuable health information right here in our community. Now, the host of Cadillac on Call, here's Jim Hall.
Good evening, everyone. Welcome to another edition of Catholic on Call, and we're once again devoting the entire program to address the latest information regarding COVID-19, the coronavirus. We've been grateful to the response of previous programs we've aired on this topic, so we'd like to utilize the time again to speak with local experts about the very latest on the situation here in the Tri-Cities area. Again, it's our aim to provide the best possible context to the current situation, including and most of all, how all of us can be best protecting ourselves. And we're again pleased to welcome to our program Heather Hill is with the Benton Franklin Health District, a nurse by training, and has worked in the Tri-Cities community and specifically in public health for a number of years, and knows probably better than anyone the efforts surrounding communicable disease in Benton and Franklin counties. Also again back with us is Dr. Brian York, who is an infectious disease physician with Catholic Clinic. And both of them have been generously agreeing to appear. I think this is, the third week in a row that we're focusing on this topic. But again, it's vitally important, as we all know. I'd like to, let's start with you again, Heather. It's the same question we've asked the last three nights, or the 3 weeks, we should say. What's new this week that we didn't know last week?
Certainly, as we look at data, as expected, we are seeing an increase in the number of confirmed cases. And right now, as of today, our data shows that in Benton County, we have 10 confirmed, and in Franklin County, 7. And we also look at somebody who's epidemiological linked, and I know that confuses people. What does that mean? And in the world of disease investigations and epidemiology, if we look at somebody who had a close relationship with a confirmed positive and shared the exact same symptoms, but maybe didn't get to be tested, we can do what's an epidemiological link in that situation. And so you will see that data on our website. And so there are 3 of those in Benton County and 1 of those in Franklin County. And as we look across the state, cases continue to increase. In Washington State, there's 2,469 positives and, unfortunately, 123 deaths. But I think it's also important to look at 93% of the people getting tested are actually testing negative, and about 7% do actually go on to test positive. Also, still looking at the fact that it's the elderly population that are still the hardest hit. When we look at case rates, it is the highest in that 70 and 80-year-old population. About 80% of the deaths are in that age group. So again, it is so extremely important to keep our seniors safe, and we're watching situations in long-term care facilities very, very closely and helping to give them guidance and bringing in Department of Health experts to help guide the various facilities and to do what is the best for those residents.
Dr. Brian York, infectious disease physician with Catholic, maybe an opening comment from you from what when we last spoke a week ago on this program.
I think since last week, we've seen some changes in ongoing readiness in our local health department and our healthcare facilities, a continuous everyday effort to make sure that our organization, Catholic in particular, I'm very familiar with what's being done there to make sure the facility is ready, that our clinics are ready, and that we're doing everything we can to meet the needs of the community. And I think we'll probably talk in a little more detail about that later on. Around the world, looking at how coronavirus has spread and how different countries have addressed coronavirus. There's some evidence that the peak of disease activity has been seen in some places where they're starting to see the numbers of new cases falling off. And so that's encouraging. That tells us some information about there possibly being an end in sight and some control measures that may be beneficial. But we still, our understanding of what's made the difference in those places is rudimentary at best. And also sometimes we have to take with a grain of salt the numbers that come out from other countries, particularly when we don't know how accurately they're presenting the data. But there is some good information finally coming out epidemiologically about how the disease spreads and what kinds of public control measures can be the most effective. And over the past week, we've seen more case reports and information about potential treatments that can be used, and that includes off-label treatments of drugs that are already available on the market, and we're seeing some case reports of success with that, and then also medications that are still under investigation that we're going to have the opportunity to start participating in trials in the near future that look promising.
Another item that's new, obviously, affects us all socially. Now, as of today, the state of Idaho, but obviously the state of Washington within the last week, the state of Oregon. What does that mean to you, Heather? And is it obviously something that people need to take seriously?
You know, I've been in public health this is my 37th year, and we train regularly for an event like this, but it's very different when you actually live it. And to be in a situation where the governor has ordered to stay home is an extreme measure, but at this point it became a necessary restriction on our life, because we don't have a way to actually stop this virus from spreading. And one of the major tools we have in our toolkit is to try to slow it down. And we've tried that with social distancing, and that did not work very well. We were still seeing increasing cases. And so the governor did take the extreme measure and tell people to shelter in place. And that is really one of the last extreme measures we can put in place to try to slow down the spread, keep people away from each other, stop the intermingling and the mixing and the close contact that puts us at risk.
I know everybody's hearing the 6 feet away and all of those general terminology within this shelter in place, but what is really the ABCs, if you will, of what you shouldn't be doing? I mean, is it exposure to someone who may be experiencing symptoms and those kind of things? What should they not be? I mean, I've heard 10 minutes around someone inside that 6-foot barrier.
There are a lot of formulas out there that people have tossed around, but I think the importance is keeping your close contact. Yes, we've talked about that 6-foot radius, and the reason the 6-foot radius came up with is because when we talk, when we cough, laugh, sing, water droplets do come out of our respiratory tract, our mouth, our nose. And we know that in this situation, unlike some other airborne type, like measles, tends to float in the air and float around a lot. This organism on the droplets tend to drop much quicker to surfaces, and they don't tend to stay floating and fluffing through the air like other organisms. And that's where we find that 6-foot radius comes into effect as far as kind of a zone. We know it's not going to travel much farther than that before it drops out of the air and onto a surface. And
Dr. York, on that social distancing, from your standpoint as a physician expert in this area, to Heather's point, it was something that has to be done.
I think so. Yes, it is something that has to be done. And I would add that even if you're with someone that you don't think has symptoms, or you don't have symptoms, you believe you don't have symptoms, it's still important to maintain that, because there is some information out there that suggests people may be able to transmit this virus before they start to have symptoms. We don't know whether people who never develop symptoms may transmit the virus, but there's certainly some good evidence that people who are eventually going to become symptomatic may have already been contagious before those symptoms developed. So that's why regardless of how everyone's feeling, they should be maintaining careful hand hygiene, 6-foot distance from other people, avoiding congregating in large groups. Even when you believe you know everyone really well and everyone appears to be healthy, it's a good idea to maintain.
And that's why when we're doing a case investigation and we're talking to somebody who actually confirmed positive, we want to know as close as possible, what day did you become ill? When was your first symptom? And then we're looking 24 to 48 hours back. And who are you in close contact with in the 24 to 48 hours before symptoms? Because we know that definitely transmission can happen during roughly that time before you were symptomatic. And the person was conducting their life as usual, thinking that they were healthy, yet they could have been passing it on, to a very vulnerable person.
You're listening to Cadillac On Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Cadillac On Call. Here again, Jim Hall.
Welcome back to the program. Tonight, again, we're talking about COVID-19 with Dr. Brian York from Cadillac and Heather Hill from the Benton Franklin Health District. Before we get back into the conversation, I would like to offer a sincere thank you to the community on behalf of all of the caregivers. I know at Cadillac, and I guess I could speak for at other health facilities around the Tri-Cities area, the community's response has been, in one word, overwhelming, impressive, and overwhelming in a really cool way. And so we thank you for that, and just the support that, whether it's Facebook posts of support, it's been really meaningful, I know, to the teams that are taking care of the patients and the teams that are supporting the people that are taking care of the patients. I also want to put a shout out to the business community. TriDec, the Chamber of Visit Tri-Cities, has been conducting a drive of community donations of materials for the past 3 days, and we appreciate the great work that has been there. I know they've collected a wide array of stuff from places, I remember booster clubs and school groups and church groups and just individual donors. And on an ongoing basis, I do want to pass along, if you'd like to continue to donate medical supplies for healthcare and service organizations in the community, you can drop them off at Franklin County Emergency Management. That's located in Pasco on 1011 East Ainsworth in Pasco during the daytime each weekday between Monday through Friday between 9 a.m. and 4 p.m. You can drop off those materials at Franklin County Emergency Management, that address 1011 East Ainsworth Avenue in Pasco. And again, we appreciate all of the great, generous community members who have offered their support in so many different ways as we navigate our way through this public health emergency. Back to our program, and I'd like to pick it up with you, Dr. York, on testing. I know you talked about some of the things that Cadillac's doing. I know there's some tent that's been put up at one of the urgent care facilities, and that's part of when people get referred for testing. But what is the state of testing right now in the Tri-Cities community?
Thank you. So it's still a frustrating problem that we are not able to test everyone that would want to test, and not even everyone that we would want to be able to test as physicians. It is getting better. We're finding the turnaround times from the labs that we have access to are improving. I think they are getting caught up with the backlog, but the overall number of tests available is still less than we would need if we wanted to be able to open up testing for anyone who presents and requests a test. The CDC has recommended prioritization guidelines, and we're trying to stick to those. And there's some flexibility in there depending on what's available. So the highest priority is testing that helps to maintain the healthcare infrastructure. So essentially, the testing of patients who are in hospitals with symptoms and healthcare workers with symptoms. And then the second level of priority, which we're finding we are able to test people who meet these criteria, would also be people who have symptoms who are in high-risk groups, like those who live in long-term care facilities, people over the age of 65, people who have underlying health conditions that have been identified as risk factors, and are first responders in the community. So those groups are also able to be tested at this time. And the hope is that as testing becomes more available over the next 1 to 2 weeks, we'll be able to start broadening that out to what the CDC considers the priority 3 group, and that would be people who work in critical infrastructure, for example. People who have symptoms who don't meet any of the criteria I'd already mentioned, particularly even including people with mild symptoms who live in a community where we're seeing a lot of COVID-19. Those are people we'd love to be able to test now, but in terms of turnaround time at the labs, the number of test kits we have available that we can actually use to swab a patient and collect a sample and transport it to the lab, we still have limited resources on those. It is getting better. The available supply is improving, but not enough that we can really expand the testing as much as we want to.
And we should point out, if we could, I know at least for Kadlec's processes, some things that have changed. The urgent care in Central Kennewick on Clearwater, that's being kind of a clearinghouse, a central site, right, for Kadlec primary care physicians to refer their patients for further evaluation?
Correct. So if any provider within the Kadlec system outside the hospital orders a COVID-19 test on an outpatient, the sample for that test will be collected at the urgent care location on Clearwater.
4804 West Clearwater, right next to the Winco. I know that up by heart, but yes.
They have set up a tent there mainly so that people don't have to go into the urgent care. They arrive, they go into the tent, they have a sample collected to check for flu, and then they can wait while that is pending. It takes about 15 minutes. If the flu test is negative, they go on to the COVID test. That will be collected and sent off, and then they're given instructions on how to self-isolate while awaiting the results, which right now is still about a 3 to 4 day turnaround time, but much better than the 7, even sometimes more than 10 days that we were seeing when we first started sending samples off 2 weeks ago.
And on that testing, you say if they're test negative for flu, then they may be given a COVID. Just does it depend on the severity of the symptoms if they're given a COVID-19 test at that point?
Well, first, if a COVID test is ordered by a provider, there's a protocol that does indicate that the influenza test would be done first, because if they test positive for flu, they will be treated for flu and will not necessarily go on to a COVID test. So if the flu test is negative, then the COVID test is sent.
And I know, just to point this out, to tie this loop up, is there's a second Kadlec urgent care location out in the Steptoe and Clearwater area. And that, my understanding, they're trying to drive non-respiratory /COVID/flu patients. If you don't have those related respiratory symptoms, go to the other urgent care. So they're trying to kind of divide the exposure. Is that the theory behind that?
Correct. And we're really trying to do that across all locations, include all primary care and specialty clinics. Patients who are presenting for routine follow-up visits or even urgent visits at any other location are being screened when they arrive. And if they meet criteria that would indicate they may possibly have COVID-19, their appointment is converted into either a virtual visit or a telephone visit so they don't actually go into the clinic. And we're doing that because we want patients who still have reasons that they have to go see the doctor for other conditions can be confident that we're not having patients with respiratory symptoms at every location throughout the Tri-Cities. We're really trying to keep things very well separated.
Listening to Kadlec on Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Kadlec on Call. Here again, Jim Hall.
A few minutes left with our guest, Dr. Brian York from Kadlec, infectious disease specialist, Heather Hill from the Benton Franklin Health District. And just a few minutes left. Dr. York, we touched on a lot of the things that have happened at Kadlec. Is they're trying to make sure that the patients are getting the appropriate care in the appropriate site, and that the containment is in place, and all of those things. Impressive. But there's some other things being done at the hospital just to allow for readiness, I guess, to increase readiness should there need to be an increased influx of patients in what currently being seen. And that's in the areas. I know one thing that's being done is elective surgeries.
Correct. So,
or not being done as elective surgeries.
That's correct. So elective surgeries have been canceled, and surgeries that were not considered emergent or anything that could, wait for a period of a few months without, increasing the risk to the patient. We've also found that patients are probably trying to avoid being in the hospital if possible. And so overall, the numbers of patients currently in the hospital is lower than what would normally be expected. That means there's plenty of capacity for any potential surge that may happen. And during this time, we're taking inventory of everything from personal protective equipment for our healthcare workers, the testing supplies that are needed to run tests for COVID-19 that we've talked about already. How many beds do we have? How many patients can we accommodate in the hospital at any given time? How many ventilators do we have? What is our ICU capacity? And all of the staffing that goes around with, even if you have the equipment, can you support those patients with adequate staffing levels? And that is being looked at on an ongoing basis every day by teams of people who are very dedicated and committed. And I can't say enough about the heroes that work at the hospital who are putting themselves out there on the front line to take care of the community, and we're ready.
Just a couple of minutes left, and I'd like to address one topic that we really haven't touched on. It's probably even more in the public's mindset with the shelter in place, and that's the emotional impact that this is having. And by the nature, some people are isolated, and they're probably feeling isolated, right, Heather? And
that's a definite concern. When we've looked at other countries where shelter in place has happened more frequently, China in particular, talking to friends in China, and the psychological aspect of being told to stay home for right now, we're being told 2 weeks, but we've seen across the world where people have been told to stay home for months at a time. And we know the psychological toll can be tremendous. So cannot stress that now is the time to reach out to people, whatever method you have, to do it by telephone, face chat, WeChat. We've got all these great ways to communicate electronically with people. And now's the time to honestly start using them. And think of your circle of friends, whether, just acquaintances, work friends, church friends, whatever groups you are involved with. Think about those people particularly that may live alone. Because if you go home to a family and you're sharing in this crisis with your family, at least you have the support of them. But we do have a lot of people who go home to themselves, and they're living in an apartment all by themselves, and it can get pretty scary when you're by yourself taking this on.
So connect, stay connected as best you can. And Dr. York, from maybe that emotional theme, what's your advice? Is it just do things that you can be in control of, whatever those might be?
Well, I think people can find creative ways to be socially engaged while still maintaining the physical social distancing that we're talking about for safety. And then I also think that there is some comfort in people knowing what they can do and taking control and ownership for what they can do to protect themselves and to protect their families. And so it's a good time for people to reprioritize a little bit. And hopefully this is an aggressive effort that we make that really does change the course of the illness, and we come out on the other side as a stronger community and, eventually get back to life as usual. But I think people need to have a short-term view that this is a temporary issue that is a fairly dramatic life change, but we can get through it, and we can choose to do the right thing.
I like the way Dr. York put it. We will come out on the other side just fine. And I think that's what we need to keep focusing on. It's going to be uncomfortable. If your life hasn't changed through this, then you're not doing it right. your life must change, and we will get through this, but it's important that we all make those changes.
You mentioned the obligation, for lack of a better word, but the to neighbors, and especially those that live alone, to check in. Final comment about, and we've touched on it in previous programs, the impact on children.
Yeah, we may watch the news and come to certain conclusions, but remember, when children watch these pictures on the news of people on ventilators and healthcare providers gowned and gloved and covered up, children look at that and they will process it within the context of what's going on in their mind, and they may not be able to verbalize, just talk about what they're seeing and how they are reacting to it without the adults and the family members asking them. So especially moving into this, what can sound like a really scary time, that we have to shelter in place. I mean, that word shelter is very scary. So make sure that you're talking to the children in your life. Ask them, how are you feeling? When you're watching television and you see those pictures come up, have a conversation, because you can do a lot to ease their stress.
Awesome. Dr. York, I think about 30 seconds, I'd like you to maybe leave a parting comment for our audience from your view as you have seen this unfold over the past month or two here in the Tri-Cities area.
Well, I think I have to say, on a national level, just looking at what's being done, from drug development to epidemiologic research, developing tests to check for antibodies to see who's immune, vaccine development, all of that. I don't think I've ever seen so much effort put into one project by so many different entities, and I really do think that we're going to see rapid progress over the next few months that's going to find solutions to this problem. And on the local level, I see the same things happening to focus the efforts of very well-educated and well-trained people on how to best meet the needs of our community while we're waiting on some better solutions, whether it be effective treatments, vaccines, better testing.
Awesome. Well, thank you again, Brian York, Dr. Brian York, infectious disease specialist at Cadlick, Heather Hill from the Benton Franklin Health Districts. Again, our thanks to Dr. Brian York and to Heather Hill for taking time out of their busy schedules to be with us. For the very latest on COVID-19, visit cadlick.org or the Benton Franklin Health District at bfhd.wa.gov or the Washington Department of Health at doh.wa.gov. Thanks for watching. We'll talk again next week.